My name is Dr. JANAKIRAM. I am an ENT skull-base surgeon. This is the way we see our outpatients. So we generally do not have a table which separates the patient from the doctor. The patient comes in and we don't have a headlight or a head mirror to see the patient. We see the patient with endoscopes. And usually we do not pack the nose or we don't spray the throat to see a patient. We just use one endoscope, that is a 45-degree telescope. You can see here, this is a 45-degree telescope. Now you can see that this scope is held like this. You can see how I am holding the scope. The camera is held between the thumb and the index finger. You can see that. And this finger can manipulate the scope up and down. So the middle finger is used to manipulate the scope up and down. And the camera is held facing upwards. So that means we are seeing downwards. So we are seeing at an angle of 45 degrees. This one single scope is enough to see all the three parts, the ear, nose and throat. And I'm going to show you how we see the ear, nose and the throat. And we have device-specific techniques to see the patients and diagnose the problems very rapidly. Now, as soon as the patient enters, we ask the history, and as soon as he finishes asking the history, we have always a sister standing there. Why do we have a sister there? Usually, the patient will move forwards and backwards. That's the Z-axis. I call the Z-axis. That is a very, very dangerous move because the endoscope might go inside and pierce the patient. So we have to fix the head. There are two ways of fixing the head. One, you can use a dental chair or a chair where the patient cannot move backwards, or we can have another sister holding the head, over which I hold the hand, and then we can start seeing the patient. But more importantly, since this is a 45-degree telescope, the patient slightly moves forward, and you can see that the sister has her one hand, that is the right hand over the head, the second hand over the chin. And then first we start examining from the right ear. You can see that she will tilt the head towards the right side and bend the patient towards 45 degrees away. So once the patient tilts 45 degrees away, you get a zero view from the telescope. So what we can do is, you can hold the pinna like this, and then you can just have a look at the tympanic membrane. So this view which we get through an endoscope is very difficult to get with a headlight, a head mirror or an otoscope. The second part to be examined is the nasal cavity. We generally do not pack the nose at all. We never pack the nose. But you can ask me a question. How can you examine a patient without anesthetizing a patient? So that is where we have introduced what is called examining the patient with a technique called the aircraft technique. So what is the aircraft technique? So what we do now is, we hold the assistant holds the patient, again tilts the patient's head 45 degrees away, and once we come forwards, we just introduce the telescope into the nasal cavity, and then we go up till the middle inferior turbinate, anterior end of the middle inferior turbinate, and we travel between the inferior and the middle turbinate, and then we land in the nasopharynx. So you can see that we land in the nasopharynx, and as soon as we land in the nasopharynx, we see all the structures we want in the middle meatus, and we can examine everything through the endoscope. And same thing is done on the other side, and if there is a septal deviation, we do what is called the Cotton's maneuver. So you can see that my palm comes down and I pull the cheek outwards. So this 4 mm endoscope can go very easily, and even when there is a septal deviation, mild septal deviation of course, very gross septal deviation is very difficult to examine, but mild to moderate septal deviations we can examine the patient very easily. The third part of my examination is the examination of the oral cavity of the larynx. You can see that the sister holds the tongue with a gauze piece. The gauze piece is held like the tongue is held like a leaf above and below. And then we again hold the head so that the head doesn't move backwards, and we do what is called the diving technique. So what's the diving technique? We go between the incisors, ask the patient to say A. A is a posterior vowel. So A, say A, and then we dive into the larynx, and you can see all the structures there, and we just come out. So this is the way we examine the ear, nose and the throat. Apart from this, we examine the neck, and that is done by manual examination, and then the examination is complete. So by this, with a single 45-degree telescope, all the three parts can be examined and without anesthetizing the patient. So we see every patient like that. So the question which you can ask me is, how do you sterilize the scope? This is a very important thing between the two patients. So we have at least 4 scopes in our OPD. So we can change the scopes when we examine different patients. Or what you can do is use a single scope, but then you will have to sterilize the scope with a solution of sterilium as well as Savalon. Wait for some time and then examine the patients. Thank you very much.